So today, so today I'll be defining sleep. After that, I'll be talking to you about why we sleep. Then we will talk about the changes that happen in the brain and in the body during sleep. And of course, I'll be talking to you about the commonly seen sleep disorders and their treatment. And if time permits, I'll talk about a little bit about the role of technology in sleep. All right. So sleep, as I've already told you, is a fundamental behavior of all animal species and definitely in all human beings. Sleep is not a passive process. It is, in fact, an active process wherein the body, the human body, produces an active state of unconsciousness, wherein the mind and the brain are relatively inactive and they respond primarily to the internal stimuli in the body as opposed to stimuli coming from outside of the body. All right. It is important for us to study the various aspects of sleep simply because we spend 1/3 of our lives sleeping. And also, it's important because the systems that are involved in producing sleep and wakefulness are closely associated with symptoms, the systems which control our emotions and behaviors. So much so, if a person is having a mental illness, you can safely assume that he or she will also have a sleep abnormality or a sleep disorder. And the phenomenon of sleep has fascinated us human beings for several millennia. All right. Going back to Greek mythology, Hypnos is the god of sleep, and his son Morpheus is the one who's responsible for producing dreams. And from Greek mythology, if you come to contemporary cinema, I don't know how many of you have watched the movie called The Matrix. Here you have a character called Morpheus, I think played by Samuel L. Jackson. He comes to Neo in his dreams and gives him an option between the red and the blue pill. I think that was a wonderful depiction of the sleep state, the dream state, and then the waking state to which Neo finally awakens to. That was a wonderful depiction of the three states. Coming to the definition of sleep, any good definition of sleep should have four important elements to it. The first one being it is a state of physical inactivity. Two, it is a state of mental inactivity. Three, it is a state wherein our senses disengage from the environment. And the fourth element is these three states should, by definition, be reversible. All right. So I want you to keep this definition in mind because you for yourselves will be able to assess the efficacy of technology, which is now currently in market, which claims to assess your sleep efficiency, both the quality as well as quantity. So if you can remember this definition, you can assess for yourselves any technology which comes into the market and hold it to this definition and see if it is good for you. Okay, so now why do we sleep? The short answer is we really don't know. All right, we really don't know. There are some very good theories which tell us why we sleep, but there is no one unified theory which can link all these theories and present one theory. So the inactivity theory states that we as human beings were less likely to die of predation at night. So therefore, as a part of our evolution, we learned to sleep at night simply because it had certain innate advantages of energy conservation. It also had certain reproductive benefits. So therefore, it helped us survive self-explanatory. It says that, we are conserving energy, and it's also scientifically proven. Our metabolism reduces by about 10 to 15% in the night. So therefore, we are conserving energy, which can otherwise be spent the next day on more useful things. Restoration theory states that a lot of wear and tear happens during the course of the day, all right, meaning at the cellular level. So all of these need fixing, and this fixing happens in the night when we are sleeping. The brain plasticity theory tells the same thing, but with respect to the brain. All right. So just think about what you people do in the daytime, right? You're bombarded with bits of information and you're expected to retain all of that and carry it forward to the next day and also into the future. So all the consolidation, the memory consolidation is said to happen in the sleep. And also, if you have observed infants, they sleep for nearly 16 to 18 hours, right, out of 24 hours. So it is postulated that brain growth happens during this time. That's the brain plasticity theory. All right. Now, coming to the electrophysiology of sleep. So sleep functions in a very predictable fashion. There are two major phases. And I think almost all of you are aware of these two phases. That is the non-rapid eye movement sleep and the REM sleep, that which stands for rapid eye movement sleep. NREM is further subdivided into three stages, that is N1, N2, and N3. Previously, there were four stages. The stage 3 and stage 4 have now been combined to the N3 stage. So each stage basically represents the relative depth of sleep, and it has its own unique characteristics, which I'll be talking to you in the next few slides. Okay. So here, if you see this image, there are a number of waves that you can see. All right. These waves are nothing but brain waves as recorded by an electroencephalogram, abbreviated as EEG. All right. You'll be hearing a lot about EEG later, but these are what brain waves look like. Okay. So say, for example, you're awake and your eyes are open, like hopefully what is happening right now. You will see that, the wave pattern is known as beta waves, and that is the first wave that you can see. The second wave is what is seen when you're awake, but your eyes are closed and you're completely rested. And these waves are known as alpha waves. Okay. The next three set of waves, that is the stage 1, stage 2, and stage 3, represent the NREM sleep. The both stage 1 and stage 2 are comprised of the theta waves. Okay. And what differentiates stage 1 and stage 2? It is the presence of K complexes. I don't know if you can see these unique set of wave patterns here. They are known as K complexes, and a set of spindle-like waves, which are known as sleep spindles. All right. That's what separates stage 2 from stage 1, the presence of K complexes and sleep spindles. And finally, when you come to stage 3, you find these very large waves known as delta waves. Okay, that is very characteristic of stage 3 NREM sleep, and that is what gives you the restful sleep. REM sleep is, of course, characterized by presence of certain waves known as sawtooth waves, simply because it resembles a sawtooth. Okay, then there is another set of waves, very interesting. It's called gamma waves. Gamma waves are seen mainly in people who are meditating. It is also seen in people who are problem solving. All right, that's a very interesting wave pattern. So now we need to kind of understand the differences between NREM and REM. And this becomes important if we want to understand the sleep disorders which are going to come later. Okay. We spend 25% of our time sleeping. Total sleep time is spent in the REM phase. And we spend nearly 75% of the total sleep time in NREM. All right. In REM, the brain is active. The physiological functions, meaning the heart rate, the respiratory rate, the blood pressure, they're all increased. So much so, both the brain activity as well as the bodily functions are almost as active as when you are awake. The important difference here is there is complete paralysis of all the muscles of the body, meaning although the brain is active, the functions are active, you cannot move. For all practical reasons, you're paralyzed. The opposite is true for NREM. In the NREM, the brain activity is down to a minimum. The bodily functions are also working at a minimal level, but the muscles are all active. So much so, in NREM phase, there is episodic movements of the limbs, okay? And these movements are typically involuntary. Dreams are seen in both NREM and REM phase. The only difference being the dreams can be recollected in the REM phase and it cannot be recollected in the NREM phase. And as the age progresses, both REM and NREM are reduced, which is why you might find that, elderly people keep complaining of very poor quality as well as quantity of sleep. So and the other important point here is most of the REM occurs in the last third of the night and most of the NREM occurs in the first third of the night. I think this diagram, will kind of clear a lot of your doubts about REM and NREM. So the x-axis represents the number of hours you sleep. So this is a typical 8-hour sleep cycle. And from being awake, once you fall asleep, you enter stage 1 of NREM, and which is a very light sleep, and you can easily be aroused from stage 1. From stage 1, you gradually progress to stage 2 and then stage 3. And then you spend some time, a considerable amount of time in stage 3 NREM. That's you spend almost about 90 to 110 minutes in the first NREM phase. And then you come back to stage 2, stage 1, and then here you enter the first REM cycle. All right, this is the first REM cycle. And it lasts for anywhere between 20 and 40 minutes. Okay, so totally you have about 4 to 5 REM cycles in the night and about 4 to 5 NREM cycles. And here, if you observe this graph very carefully, most of the REM is concentrated in the latter half of the night, and most of the stage 3 NREM is in the first third of the night. Okay, so this is how your sleep is divided. Coming to the functions of sleep, I think it is closely linked to why we sleep. Sleep has its restorative function, homeostatic function. Homeostasis basically refers to the body's attempts to maintain an internal equilibrium. All right. And sleep is absolutely essential for maintaining this homeostatic function. It is required for temperature regulation. NREM is responsible for thermoregulation, that is temperature regulation and energy conservation. And REM sleep is responsible for memory consolidation and it enhances cognitive functions the following day. So mechanism of sleep, again, this is a very complex topic. I have simplified it, and just to give you a gist of how sleep is regulated, there are two key parameters here. One is called the circadian rhythm, and the other one is called the homeostatic mechanism. The circadian rhythm refers to the internal biological clock, which is governed by the brain, and that controls your sleep-wake cycle. And the homeostatic mechanism is a mechanism which is present in the body, which strives to achieve equilibrium. So to give you an example, say for example, you are awake for a very long duration of time. Such individuals, the propensity to sleep is much greater because the body wants to revert to the mean. All right. So it is an interplay between the circadian rhythm and the homeostatic mechanism which regulates one's sleep. Coming to the commonly seen sleep disorders, by and large, the most common sleep disorder is insomnia. Okay, and now insomnia is actually an umbrella term, and it has a number of illnesses in it. I'm going to be talking about shift work sleep disorders and sleep disturbances secondary to mental illnesses because I think that's the most relevant topic here for now. I'll also be talking about sleep apnea, which includes hypersomnia. That's a distant second. And we'll also talk about jet lag syndrome and the difference between nightmares and night terrors. And if time permits, we can also talk about narcolepsy. Okay, so what is insomnia? People say that, I'm having insomnia. What do you mean by insomnia? Insomnia is a disorder wherein a person is having difficulty falling asleep and or staying asleep. This should happen for at least 3 nights in a week and for more than 1 month. Okay. Now, there are different types of insomnia. The most common types of insomnia are one, due to inadequate sleep hygiene, which I'll be talking about in the next slide. And two is a very unique condition called sleep state misrepresentation. It is very commonly seen in my OPD. And this is a condition wherein the person complains of insomnia, that is difficulty initiating and maintaining sleep. but there is no objective evidence for the same. Meaning, if you were to do a sleep study, there is no evidence of insomnia. Usually, such people will have certain maladaptive thoughts about how long they are sleeping, the quality of their sleep, and it usually points towards another mental illness, typically somatic symptom disorder. So, such people, we kind of give them a comprehensive evaluation and then treat the insomnia by treating another condition which is usually accompanying the insomnia. Okay. Now coming to the treatment. So I would want all of you, if it's possible, to make a mental note of what is written here. If not, you can pull out your phones and take a photograph of this particular slide, because you can incorporate all of what's written here without much additional effort, and it is going to dramatically improve the quality of your sleep. All right. So this is universal sleep hygiene. Okay, it's a list of basically a list of do's and don'ts, which will kind of improve the quality of your sleep. So the first thing that you need to do is keep a regular sleep-wake schedule. Meaning, if you're sleeping at 11 p.m. and waking up at 6, stick to it no matter what. Incorporate some exercise into your routine. If possible, your bedroom should be at least 2 to 3 degrees cooler than the other rooms. That is, if you're having an AC. And just before going to bed, learn to unwind both physically and mentally. You can unwind by doing certain relaxation exercises, which I'll be talking about in the next slide. Go to bed only when you're sleepy. And if you're not getting sleep while on the bed, get out of the bed, go to another room, preferably sit on a couch, dim the lights, do something which is non-arousing, all right? And only when you are sleepy, then go back to your bed. The list of don'ts, and the most important don't is avoid daytime napping. That's the single most important thing that you need to do. Avoid strenuous exercise just before sleep. Finish your food or dinner 2 hours before you go to bed. Preferably stop all using gadgets 2 hours before you go to bed. No amount of alcohol or tobacco is good for you. So if possible, completely eliminate that from your completely eliminate tobacco and alcohol. And when it comes to caffeine, caffeine before 3 or 4 p.m. should be okay, not after that. And of course, don't try too hard to sleep. The more you try, the more elusive sleep becomes. So allow it to happen naturally. Then comes the second thing that which you people can do, is something known as stimulus control therapy. Stimulus control therapy is a fancy terminology given for a set of common sense measures which all of you can kind of incorporate. Basically, a list of do's from the previous slide. Okay, going to bed only when sleepy, using the bed only for sleeping and not for eating, working, watching television, etc. All right. And if you're not getting sleep, like I've already told you before, get out of the bed, do something non-arousing, and then get back to bed when you are feeling sleepy. The main aim here is to condition your mind to associate bed with rapid onset of sleep. That is the aim of not using the bed for any other purpose. And of course, having a regular sleep-wake schedule will definitely help. Coming to the third thing that you can do is something known as relaxation therapy. And the relaxation therapy which I want you to follow is known as JPMR. That is Jacobson's Progressive Muscle Relaxation. You can look it up on the internet later. It takes about 5 to 10 minutes to learn the whole exercise, and it takes about 10 minutes for you to do it. All right. Each session takes about 10 minutes. So when I was talking to you about unwinding before going to bed, this is what I would want you to do, JPMR. CBT is, of course, done by a therapist. People with insomnia usually have certain maladaptive thoughts about sleep. So it is the therapist's job to identify these maladaptive thoughts and replace them with healthier patterns of thinking. And of course, if none of these things work, you always have medications. And there are a certain specific set of guidelines when we prescribe medications. Okay, I don't think that's quite relevant here in this talk. Coming to hypersomnia. Hypersomnia are prolonged periods of well-consolidated but non-restorative sleep. Such individuals sleep for about 10 to 14 hours, but usually wake up unrefreshed and usually disoriented. Sleep apnea is a condition wherein people have repeated episodes of apnea. And an apnea is defined as a cessation of breathing for 10 or more seconds during sleep. Such individuals are usually obese. They have excessive sleepiness or hypersomnia. They have restless sleep, multiple awakenings in the middle of the night. They usually wake up with a choking sensation or they gasp for breath. Okay, these are the typical symptoms of sleep apnea. There are two types of sleep apnea. The central sleep apnea, wherein there is a reduced respiratory effort. Okay, there is no breathing because there is no effort. And then there is the obstructive apnea, wherein the upper airways, that is the airways which begin just behind the nostrils, they kind of collapse during sleep. The collapse can be complete or partial. Treatment, of course, includes weight reduction, delivering oxygen under pressure through a tightly fitted mask known as positive airway pressure. And if for obstructive sleep apnea, there is a surgical procedure known as uvulopalatopharyngoplasty, basically preventing the airways from collapsing inwards. It's called UPPP. All right. So that's sleep apnea in a nutshell. This, I think, is very important and applicable for many of you. Shift work sleep disorder. All right. Shift work sleep disorder means your circadian rhythm, that is the sleep wake rhythm, is in direct conflict with the rest activity cycle, meaning you are expected to sleep and therefore rest at night, and you are expected to be awake and therefore be active during the day. For such individuals, this rhythm is reversed, okay, mainly because of your job requirements. And the different patterns include rotating schedules, wherein you are expected to have a morning shift, then progress to an afternoon shift, and then the night shift. All right. This constant readjustment can kind of, it takes its toll on the circadian rhythm. Okay. And it's further complicated, especially if the worker has to kind of readjust or return to the baseline circadian rhythm on holidays and weekends. Okay, such individuals are constantly sleep deprived. Their work performance might be affected. There's increased risk of accidents, especially if they have to operate heavy machinery. They can also have somatic symptoms, which are psychiatric, indicative of a mental illness. So the treatment is, if you have to work in shifts, always prefer a clockwise direction of shift rotation, meaning go from morning shift to afternoon and then to night shift. All right. Don't change this direction. Okay. Minimize the frequency of rotation. So suppose if you're in the morning shift, stick with that shift for at least a month. They say 2 to 3 weeks is enough, but to be on the safer side, 1 month will definitely help you. And if you have to work in the nights, please reduce the number of consecutive days worked from 7 to at least 4 or 5. And once you have finished your night shift, appropriate use of darkness will help, meaning using dark glasses, blackout curtains. This is basically to train your brain and your mind to sleep during the day. All right. Using external aids like that will definitely help you. Coming to jet lag syndrome, jet lag occurs in individuals who have to rapidly change and travel across several time zones. All right. Typically, going west is easier because it delays your sleep cycle, and going east advances your sleep cycle, and that is much more difficult on the system than going west. Okay, such individuals often present with insomnia, that is either difficulty falling or asleep or maintaining sleep. It lasts for about 2 to 14 days, and the treatment is exposure to bright light. Going out into the sun and staying there for some time should kind of help. Now, coming to two very unique disorders known as nightmares and night terrors. I mean, all of us have had bad dreams. Okay. Now, are those bad dreams nightmares or are they night terrors? Have you ever thought about it? Okay. So, nightmares is a disorder of REM sleep. These are anxiety provoking dreams, complex dreams basically. And as the dream progresses, it becomes increasingly frightening, and it typically culminates with awakening the individual. Okay. The hallmark of any nightmare is that the content of dreams can be recalled in great detail the next morning. Okay. Some of the common causes of nightmares would include traumatic events which have happened during the day, withdrawal, substance withdrawal, that is alcohol withdrawal, cannabis withdrawal, and certain mental illnesses like personality disorders. Treatment is following universal sleep hygiene, stimulus control therapy, as we have discussed previously. And if that doesn't work, then we can start such people on medications. Night terrors, on the other hand, is a disorder of NREM sleep, meaning it happens in the first third of the night as opposed to nightmares which happen in the last third of the night. Okay? It is characterized by a sudden arousal with intense fearfulness. So typically you have an episode which begins with a scream or a cry. The individual is profusely sweating. Usually their heart rate is raised, the respiratory rate is raised, blood pressure is raised, and usually they jump out of bed, okay, wildly flinging their arms. There are two very important features of night terrors. The first one being such individuals are unresponsive to your efforts to calm them down, especially when they are having that episode. And the second one is they have no recollection of what has happened the previous night. You talk to them the next morning, they have absolutely no clue as to what has happened to them the previous night. Okay. So some of the causes of night terrors are fever, stress, sleep deprivation, especially if it is happening for a prolonged period of time, seizure disorder, and any medication or drugs of abuse which suppresses the nervous system. Treatment would include primarily medications. No amount of sleep hygiene or stimulus control will help for night terrors. Okay, coming to the next disorder, it's called restless leg syndrome, wherein there is an irresistible urge to move the legs when the person is trying to fall asleep. I think the operative phrase here is trying to fall asleep. So it happens when you're about to fall asleep. So you have this sensation as if worms and ants are crawling on your legs. All right. And the only way to alleviate discomfort is for them to get out of the bed and start walking around. Some of the causes of restless leg syndrome include anemia, diabetes, rheumatoid arthritis, and therefore treatment of restless leg syndrome includes treatment of the underlying condition which has caused this syndrome. Restless leg syndrome, by the way, is also known as Ekbom syndrome. Sleep disturbances secondary to mental illnesses. I'm going to be talking about anxiety disorders, depressive disorders, and substance-induced sleep disorders. In anxiety disorders, primarily, patient will have difficulty falling asleep. Okay, that's the hallmark of any anxiety disorder. Depressive disorder, on the other hand, will by definition have early morning awakenings, meaning you wake up at least 2 hours before your usual waking hours. Say, for example, your usual waking hour is about 7 a.m. So the individual wakes up at around 3 a.m., 4 a.m., 5 a.m. That's very typical of a depressive disorder. When a person is consuming alcohol and cannabis, what happens is there is REM suppression, meaning the number of REM phases are reduced. All right. And once the person stops the alcohol consumption, there is a rebound increase in REM, meaning when the REM increases, you're also likely to have certain vivid dreams and also nightmares, right? So such individuals who are having alcohol withdrawal or cannabis withdrawal not only will have insomnia, but they will also have a lot of nightmares. People who are dependent on tobacco, basically nicotine, have a disturbed sleep because they have multiple awakenings in the night, mainly due to nicotine withdrawal, simply because you're not smoking in the night. Okay. So after a particular point in time, the withdrawal symptoms kick in and that disturbs your sleep. So now I've given you, I think, a lot of information about uh, various sleep disorders. We've spoken about the different phases of sleep. We have spoken about the differences between the two phases of sleep. Now, what is the information that I want you to take home? All right. Mainly with respect to when to seek help. You need to seek help if you are having any of these four symptoms. All right. Make a mental note of these four symptoms. And if you're having any of these symptoms consistently, that's when you need to seek help. Okay. There is either difficulty falling asleep, difficulty staying asleep, early morning awakening, that is waking up 2 hours before your usual waking hours, and not waking up refreshed. Okay, so you don't get that sense of, you're feeling refreshed when you wake up. And if that is something which is persisting consistently over a period of, say, a month, that's when you need to seek help. Now, coming to sleep studies. So, for example, a patient walks into my clinic and he says that, he's having difficulty falling asleep. He may or may not be having some substance use, may or may not be having some psychiatric symptoms. What do I do? So I take a detailed history, I evaluate the patient, and if I feel that I need a detailed analysis of his sleep, I refer him to a diagnostic center or a hospital which does a test known as a polysomnography. Polysomnography is basically a collection of a number of tests, which the tests include tests which measure the brain waves known as an EEG. There's another test called the ECG, which measures the heart rate and rhythm. The EOG, that is the electrooculogram, measures the eyeball movement. There is an EMG, which measures the muscle tone, that is the electromyogram. And then there are sensors which measure the respiratory effort and also the blood oxygen level. So it is a comprehensive analysis of your sleep. It kind of tells you how many cycles of REM, how many cycles of NREM, the problems that you've had in each of these phases, the time that you've taken to fall asleep, the number of times you're waking up, and the total sleep duration, the sleep efficiency. So it is a wonderful test and it is the gold standard. Okay. The next best test is known as an actigraphy test. Okay. It is done by an actigraph. The actigraph consists of a device which is almost as big as a smart watch, and it goes onto your wrist. And then there are a few sensors which go onto the fingertips and a few sensors on the chest. Okay. Basically, the core of an actigraph is the presence of an accelerometer. An accelerometer basically detects movement and the absence of movement. So what actigraphy does is detecting movement and detecting rest. This data is then fed to a software which then kind of interprets the rest as correlates it with sleep and the movements and correlates that with the waking hours. Okay, that is essentially what actigraphy does. And all the smart watches that you're wearing and all the wearables now have this accelerometer. So to kind of summarize what happens in a smartwatch, it doesn't measure sleep directly. In fact, it is only an indirect measurement of sleep. It measures the waking state, and it measures, or rather it measures activity and it measures rest and correlates that with sleep and waking state, not a direct measurement of sleep. Okay. So if my suggestion for all of you is, if you are having any of these four symptoms, seek help. Okay. Relying on smartwatches or any other existing technologies may not give you the complete. In fact, they tend to overestimate the number of hours that you have slept, and they also overestimate your sleep efficiency. So, I mean, concluding my talk, understanding is a work in progress, right? Although a lot of questions have been answered, there is still a lot of work that needs to be done. And there is a lot of ongoing research which are trying to clarify the functions and mechanisms of sleep. And that will not only help us understand sleep, but it would also help us understand mental illnesses, right? Because the two are closely interlinked. I hope I have done some justice to this vast topic, and I'll be happy to take any questions if you have. Thank you.
Thank you, Doctor. Now we can go through the chat section where there have been few questions asked.
Yeah, please.
Yeah.
Akshat, but I think you need to talk to Arul to, I mean, I think he's going to answer your questions.
Yes, doctor, I have informed those.
Yeah, Vishal Rao. So for someone who requires about 7 to 8 hours of sleep, for someone who requires 7 to 8 hours of sleep, but is only able to get max 5 hours each night due to whatever personal household circumstances, are there any steps to take to improve quality of sleep? Universal sleep hygiene would help. Stimulus control therapy would help. All right. And I think the second part of your question is linked to the sleep hygiene. No, supplements don't help. And many people self-medicate with melatonin. Please don't do that. Okay? Please don't do that. Melatonin is an endogenous chemical which is produced in the brain, and only what is required is produced by the body. Please don't supplement it. You are only going to mess up your circadian rhythm in the long run. Okay? Follow the measures that I've given you. They are simple measures, common sense measures. The key here is consistency, sticking to whatever has been taught and whatever has been given to you. If you do that over a period of time, your sleep will be fixed. I hope I've answered your question, Mr. Vishal.
Yes, thank you.
How long do vivid dreams, Prajwal, how long do vivid dreams, nightmares last in case of cannabis withdrawal? As long as your REM phase lasts. And typically a REM phase lasts for anywhere between 20 and 40 minutes. The NREM phase lasts for anywhere between 90 to 110 minutes. So like I've already told you, alcohol, cannabis, and most of the other substances which people tend to abuse reduces the REM duration. So it can reduce from 20 to 40 minutes to say less than 20 minutes. And in that, you might be having a nightmare. So just to kind of guess it, say a few minutes, nobody really measures the duration of nightmares. It's just that whether you had a nightmare or whether you not had a nightmare or whether you had a restful sleep. If you've had nightmares, obviously your sleep is disturbed. A 68-year elder has night terrors, which occurs usually 2 hours after sleeping. Any lifestyle solutions or medications? So like I said, we need to first ascertain the diagnosis. So I need to differentiate between night terrors, nightmares, or any other problem which might be going on. So I'm not going to assume that it is night terrors. Assuming, say, for example, there is really night terrors, the treatment is medications. Okay, no lifestyle changes will help here. Yeah, this information is good, but is overwhelming at the same time. It can be definitely, because I have tried to condense a lot of information. Sleep, by the way, sleep is a topic which when I was doing my post-graduation, this topic went on for about a week. Okay, that's how long we kind of had to go into the details. And unfortunately, I've been given, say, about 40 minutes to kind of, and I had to condense them. So I apologize if the information was a bit overwhelming. And again, the next part of your question, go-to habits, again, sleep, universal sleep hygiene. Don't spend too much of your money trying to buy devices or wearables if it is only to assess your sleep. I would rather have you go to a psychiatrist and talk about your problems and fix your sleep cycles, rather than spending huge amounts of money and you're not going to get any definitive solutions, and eventually you will go back to meeting a psychiatrist. Sleep and nutrition, fantastic question, Mr. Mustafa. Fantastic question. There are certain foods which help a person fall asleep, and then there are certain foods to be avoided. Again, the effect on sleep is very minimal, all right? It's minimal. You should be fine as long as you are kind of finishing your dinner 2 hours before you go to bed. Make sure you don't stuff yourself just before going to bed. Don't consume alcohol, don't consume any substances. Okay. A glass of milk, it said that a glass of milk will help you fall asleep. So if at all 1 hour before going to bed, you can have a glass of milk if you're not a diabetic. Good question, Mr. Sangram Bhaskar. Sleep paralysis, right? Sleep paralysis almost always is not seen in itself. It's a part of something known as narcolepsy. Narcolepsy is a condition wherein it is characterized by four very important symptoms, okay? The first symptom is there are irresistible urges to sleep. Okay, these people have these very short naps, and these naps are typically very kind of refreshing naps. And these urges to nap are almost irresistible. Okay, that is the first symptom. The second symptom is sleep paralysis, meaning they wake up, they're completely awake, they're aware of their surroundings, but they're unable to move their body. Okay, they're unable to move their body because the muscles are paralyzed. That's the second symptom. That is sleep paralysis. The third symptom is known as cataplexy. Cataplexy is sudden loss of muscle tone associated with an emotional outburst. Either the patient is screaming or crying, and they suddenly lose their muscle tone, meaning they kind of, if they're standing, they tend to collapse. And if they're sitting, they kind of fall down. That is cataplexy. And the fourth one is known as hypnagogic hallucinations. Hypnagogic hallucinations refers to hearing voices that are otherwise not heard by others, seeing people that are otherwise not seen by others, and all of this happens as the patient is going to sleep. Okay, the tetrad of symptoms of hypnagogic hallucinations, cataplexy, sleep paralysis, and the irresistible urges to kind of nap frequently comes under a condition known as narcolepsy. That's the main cause of sleep paralysis. I hope I've answered your question, Mr. Bhaskar. Okay, Mr. Ayush says that I came across something called binaural beats, which claim to give good quality of sleep if you are listening to it via headphones. Not proven, not proven, not at all proven. Okay, these are, some random studies which says that their studies showed that, sleep has kind of improved after a particular intervention. But there are no large randomized, double-blinded, randomized controlled trials which have kind of replicated these small studies. So don't fall prey to all these quite dubious studies, I would say. Okay. By the way, the information that I have given you is all scientifically proven. All right. These are all information that is obtained in any standard textbooks and is a part of the treatments which I kind of prescribe to my patients. And almost all psychiatrists do the same thing. I think Sunila, I think the best thing to do is to consult a doctor. Mr. Mustafa asks, on a personal note, I also get time to exercise in the evening post work. What should I do there? Again, if it is around anywhere before 7 o'clock, I think it should be fine. 7 p.m. Miss Neha asks a question where there is a typical time of falling asleep, but always wake up 4 to 5 hours only. After that, it is very difficult to fall asleep. Can fall asleep after 2 to 3 hours again. Go to a doctor. Yes, please consult a doctor. Please consult a psychiatrist, not any doctor. Normally fall sleep for
फिर से टूर प्लान में
normally fall late for sleep and sleep lasts
टूर
for
प्लान
only 4 hours. Again, please consult a doctor, Mr. Mukherjee. I think you
इसमें
need an evaluation, a comprehensive evaluation. Mr. Tushar, there is really there's no harm if you're kind of moving around in bed. I mean, there is, unless you, of course, you don't harm yourself by falling down and kind of injuring yourself. As long as you're on the bed, different position shouldn't really be a problem. Again, all these things happen in the NREM phase, right? That's when your body is active, but the brain is inactive. So that's when you kind of move around. Again, so to answer, Ms. Nikita, so to answer your question, how to avoid nightmares, sleep hygiene, stimulus control therapy, and if that doesn't work, consult a doctor. Any other questions, sir, apart from whatever has been asked? Okay, Mr. Ayush, relaxing sounds. Typically, instrumental music is fine. So, relaxing sounds as a corollary should also be fine. Yes, go ahead, no problems. But not these sounds which go on for 2 to 8 hours. It should stop when you're going back to sleep, right? So you come out of the bed, you do something which is non-arousing, you listen to these relaxing sounds, and once you're sleepy, you switch it off and then go back to sleep.
Thanks, doctor.
Walks before dinner will help. Yes, Mr. Bhattacharya. Yes, removal of all gadgets is definitely is going to help you. Again, hot chocolate, all these things are not proven, right? You can do it if it's helping you, but it's not scientifically proven, Mr. Adhar, if I'm getting your name right. Please don't nap. It's not healthy, not at all. Sunila, no, please don't do that. Mr. Sunila, don't do that. No, no naps. Avoid napping. Relaxation techniques, Ms. Shweta, is JPMR. You can look it up on the internet. It takes about 5 to 10 minutes to learn it, and it takes about 10 minutes to go through the whole process. So if you can do it when you're unwinding just before going to bed, it's going to help you. What details do you want, sir? Mr. Ashwin, what details are you referring to? Lack of sleep and its linked to heart disease. Good question. Very good question. Lack of sleep disturbs your circadian rhythm. Lack of sleep also puts your adrenal glands and all the other organs which are responsible for dealing with stress in a heightened state of alertness. All right. So if you're not sleeping, you're stressing your body. And one off or maybe a couple of days should be fine. But if the lack of sleep is prolonged, it means that your body goes into a state wherein it is perpetually responding to this state of stress. And that is definitely deleterious to your heart health. Okay. So prolonged periods of sleep deprivation can be potentially, bad for your heart. Good question, Mr. Chiranjeevi. There are the long sleepers and then there are the short sleepers. Long sleepers are those who need about 9 hours of sleep every day. And short sleepers are those who need about 6 hours. 5 hours is iffy. Not many people can kind of function adequately with a 5 hour sleep. But if it is kind of, if you're used to it, then go ahead, please. Again, all these things are tailor-made for the particular individual. There is no one size fits all, right? So it depends on the individual, his family history, his comorbid illnesses, comorbid mental illnesses. All of that needs to be taken into account, and then only then we can kind of tell them how many hours of sleep is ideal for that particular person. Please get in touch with Plum, and I think Mr. Arul can help you, Mr. Ashwin. So, Mr. Freddy, let's say I'm sleep deprived for from past few days. Then one day I have ample time and I decide to sleep for maybe 1 to 2 hours in the afternoon slash evening. Doing this one time, once in a while, will it be good or bad? Again, see, I mean, ideally, napping should be avoided, all right? But please kind of, we are living a life wherein, you are tired, you tend to sleep, doze off in the afternoon. That's perfectly acceptable. But don't make it a habit, okay? A one-off nap or one-off kind of a sleep during early in the morning, like say, or in the mid-afternoon, that's okay. But if you kind of make it a habit, that's when, your problems will begin. So if you are sleep deprived for a few days and then you suddenly decide to kind of take a 1 hour nap in the afternoon, that's okay. I mean, it's not going to kind of majorly change your sleep cycle. But if you are going to do that consistently, that's when you're going to have a problem. There are psychiatrists who specialize in sleep problems, but all psychiatrists are trained to deal with sleep related issues. I hope I've answered your question, Ms. Neha. Any more questions? Okay. So, Mr. Sagar, it might help you fall asleep, but please avoid videos because anything which stimulates the mind in the long run is deleterious for your sleep, all right? Because it would kind of activate certain centers and your mind would then start to think and start to ruminate on what has been told in those videos, and your sleep will be affected. Thank you, Mr. Prashant. Or rather, thank you, Ms. Neha. Mr. Prashant, some good resources for relaxation therapy. JPMR. JPMR is a proven technique, all right? JPMR is very underrated, but a proven technique. It's called Jacobson's Progressive Muscle Relaxation. Snoring only affects you if it is part of another illness like sleep apnea. Otherwise, in the absence of a disorder, snoring only affects the other person who's sleeping with you. Ideal sleep time duration 6 to 8 hours. 6 to 8 hours. Yes, yes, it is beneficial. Evening baths are beneficial. Hot water baths in the evening should help. I'm very sorry, Mr. Ashwin. I have never practiced yoga nidra, so I don't think I'll be able to answer that question. I can kind of read up on that and then kind of get back to you though. I have never practiced yoga nidra, so I'm sorry, I don't think I'll be able to answer you. Our sleeping cycle shifted from 10 p.m. to 6 a.m. Now everyone sleeps around 12 a.m. and wakes up around. I mean, see, I don't want you to kind of follow what others are doing. Do what is good for you. Okay. If you are blessed with a work schedule which ends early, and if you are kind of blessed, in a way wherein you can sleep early and wake up early, do that. Just because everybody is sleeping at 12 or 1 or 2 doesn't mean it's healthy. I have never come across tapping mouth and that decreasing snoring. So I don't think that's going to help, sir. Can you please elaborate what you mean by non-sleep deep rest? So from whatever I have read, that is similar to yoga nidra, and I really am not aware of that. I'm sorry. And popularized by Dr. Andrew Huberman. I'm sorry, I don't have an answer for that question, sir. I need to read up about it. But rest assured, I do have my own limitations. I'm not claiming to kind of know everything about sleep, especially the newer developments, especially these non-sleep deep rest. But the information that I have presented to you is, for all practical reasons, enough for you people to have an excellent quality of sleep and an adequate quantity of sleep. And I've also, I think, given you when you should seek help. And I think that should cover most of your life to kind of improve the quality of your life, rather. Sudarshan Kriya is basically a technique which will ultimately increase the number of gamma waves in the brain. So that should help because it would calm your mind, right? So anything which calms your mind definitely will help you, in your sleep cycles.